Good evening. Welcome to the third Newmarket Alliance for Substance Abuse Prevention Community Forum. Tonight we have a wonderful group of people here to talk about some new realities that we have in our battle against drug misuse and some new faces. So as we begin our time together, I'd like to again welcome you. Thank you all for coming. Thank you all for volunteering your time for this important effort in our community and across the Seacoast. And I'd like to introduce our first speaker tonight. Sergeant Rick Bodette from the Newmarket Police Department will be providing us with some updated information as to how things are going in Newmarket. So with that.
Thank you. Looking over the stats from 2015, it was kind of a eye-opener that from January of 2015 to the end of April, or May 1st of 2015, the Newmarket Police Department had, it gave me a percentage, it was 7-point-something% of drug-related overdoses. So we had 7 just in that short 4-month window, which, working day to day in it, I guess I didn't realize the gravity of where we were until you look at the actual facts that are presented. I'm happy to say that running the same stats for 2016 in the same time given of 4 months, we've only had 1 overdose that we responded to. I checked with Fire and Rescue just to confirm that I wasn't missing any data, and in speaking with Mike Pelzar, he reminded me that the Fire and Rescue responded to a call, and it was actually Newfield, so that's why it wasn't in our database, but wanted to remind me and tell people at home that the call that they went to in Newfields was someone overdosing, and they were hesitant to call Fire and Rescue because they had Narcan, but they didn't know how to do it, and it wasn't working properly. And when Fire and Rescue showed up to try to render aid, they were still trying to get help without having to use fire services or the police showing up. And that's a concern I have, is maybe some of the numbers that we're seeing at Newmarket as a small window of statistical data is showing that Narcan is maybe we're not able to keep track of the stats that are out there because of the fact that Narcan is now on the street and is readily available for people to administer on their own. They may not be going to the doctors, but I got to say this. If any of you caught the news before you came here tonight, and you at home have caught the news, the new drug that's going around, I think it was X18 is what they're calling it. It's already in New York. They're already starting to see it in parts of Maine. They're saying 1,000 times worse than morphine. And just let's be clear, if you think that Narcan, what you have to try and save someone, will be enough, they don't know. They don't even know if Narcan will help stop that effect. So that's a concern of mine in law enforcement, that here now we're dealing with another wave of a different drug that was intended, made in Canada, intended for large animals. Now it's on the streets and that people are already using that. So where it's already on one side of us and now on the other side of us, it's only a matter of time before it hits our streets. And all I can say is, numbers-wise, I'd like to credit our organization that people maybe are starting to talk about it. Maybe people are being a little bit more vigilant about their surroundings. I don't know what the effects are, but numbers-wise, they've dropped off a little bit. I think even 1 or 2 is still too much. But in terms of needles, last year we had significant, I think it was 5 or 6 calls for needles that we needed to go grab. And I want to say this year we've only had 2, so that's dropped off a little bit too. Again, it's hard to do statistical data with information that we're putting in that's reported to us when we don't know what is going on with Narcan being administered on the streets. And I will say, I looked at the state's overall number. It's hard to tell for Newmarket because they put you in a color group, and it'll say 1 to 5 is a dark blue, 5 to 15 is a light blue. And all I can tell you is we've gone from the dark blue to the light blue, and that means the Narcan administered, it could be done at the hospital, or it could be done by somebody that went to the hospital. So I can't tell you statistically what that number is. We're just not getting reports at the Newmarket Police Station to be able to keep that statistical data. So, you know, that's a concern. But the good thing is it is out there, and maybe it is saving lives, and I hope that people are getting it that need it and are conscious about having it in case. So that's my statistical data for Newmarket.
I have a question regarding the 911 calls that are made that might be reporting an emergency of some kind
Sure.
in Newmarket. Do the 911 operators contact the police department? Is that one of their normal
Yes.
calls they make?
So if you dial 911 right now, yeah, I'm sorry. The question was for you at home that didn't see it or will be watching this later, where do 911 calls go that filter through Newmarket PD? Newmarket is, we have the luxury of having our own dispatch center. So if you were in Newmarket and you called 911 right now because you had an emergency, instantaneously your phone call goes to Concord where the headquarters are, but instantly they send us on a computer screen the nature of what type of emergency is going on, whether it's be fire, police, or a combination thereof, to be able to have to go there and respond. So we know that there's a problem at that address. We don't know the full circumstances, but we're already rolling apparatus to get to you. And at that point, you'll hear of someone explaining on the line, give us some more information, so we can update first responders to get there and know what they're dealing with.
I found out at Winnicott High School in 2012 that only 20% of the freshmen knew how to make a 911 call. No one at their homes had explained this to 80% did not know how to make the call.
Wow.
20% did. That's huge.
Yeah.
And when that was found out, they engaged a resource officer to start training the kids at school. And I guess my question is, does the school use resource officers from the police department?
I can't speak specifically about 911, but we do use our school resource officer to go up to the elementary school.
Well, I
and
was just
teach
trying to
different
think of
curriculum.
a method to, how
Yeah.
can the kids get trained? I mean, this is a terrible
Yeah,
lack of awareness.
I can't speak on behalf of Newmarket Elementary School and what they're teaching the kids at that level. I can tell you that,
Well, no, I'm thinking middle school. Now, this
well, I would hope they're actually starting them before that.
is middle school, yeah, oh, yeah.
Again, I can't speak on their curriculum for that, but I know when my kids are going through elementary, they go through a phone training and they teach them 911 because I actually had my daughter inadvertently dial it one day and got Newmarket. So it works, but yeah. Any other questions or? Well, thank you.
Thank you, Rick. What we're going to be doing is having a Q&A session at the end of our presentation time tonight. So I would invite you to hold your questions if you can, or if you have things that just have to come out during the presentation, that's fine too. But we appreciate that comment we got, and I think the takeaway from that is make sure your children know how to use 911. We can depend on our schools for some things, but that's an easy thing we can, each one of us as parents in our community, as grandparents, as friends of children, ensure that our kids know how to use 911. I think it's something we can very simply do, so thank you for that input. And speaking of youth, we're going right there next. We have Lindsay Malsbury joining us now from Newmarket School Granite State Alliance, and we're excited to hear about all the good news and all the good work that our youth right here in Newmarket are doing. So welcome, Lindsay.
Thank you. Can you guys hear me? Okay. All right. So for those of you who don't know, Youth to Youth is I meet with the kids for from 2:30 to 4 after school on Friday. And it's a group of wonderful students who want to promote awareness in their school and community about drug use. And it's more of a preventative club. That's our main goal. So some things that we have done and already got accomplished this year, I made a list. It's getting kind of long. It's awesome. So in the beginning of the year, they had a presentation to all of the middle school. And within that presentation, they had all the middle school students take a pledge to be drug and alcohol free. They also do we try to shoot every 2 weeks, but sometimes we get so busy it's once a month. We have an informational board. This month it's about alcohol and how alcohol can affect you. So every month they have an information board about heroin or marijuana, and the kids really like it. They worked really hard on it. We also went to a field trip in Dover. It was a really great opportunity for the kids. A group from Boston of recovering addicts came down and taught the kids how to put on skits in their school. And it was really interesting to see them do that because they got to have a Q&A with the individuals and learn about, how you get addicted, how they got out of it, and more ways to get the word out about prevention. So that was really cool. They also went to a conference in Dover in the very beginning, which was great. I have an example. The kids also made these posters and posted them all around downtown in the local businesses. It's about how to properly dispose of your prescription medicine. We found out that was a huge problem in a lot of towns where people just flush their medicine down the toilet, or they just leave their old medicine in the medicine cabinet, and then kids could take that medicine accidentally. So they made a bunch of posters like that and put them downtown. They also, this Friday actually, they're doing a presentation called Samantha the Skunk to first and second graders in the elementary school. That's just a skit that teaches you not to take your parents' medicine or any medicine that's not given to you by a doctor or a responsible adult. At the same time, they're going to put on a presentation to the 5th grade to tell them what Youth to Youth is. So when students come into 6th grade next year, they already know what Youth to Youth is, so we can have more members starting off the year, which is great. And last Friday, before April vacation, was Wellness Day. It's pretty much a day where they have different activities and learn whether it's exercise or how to eat healthy. And the students put on a presentation about pop culture. And they also had a Jeopardy game where it makes students more aware of the exposure to drug references they see in everyday life. And then we also did, they're currently making, they're not done yet, they're making t-shirts for the club, and they're very excited to wear them and promote their club even more. And I also made a Google Classroom for the group. Do any of you know what that is? Do you want me to explain? It's pretty much, it's really awesome. I can show you what it is. It's a site that they can go to, and every week we post what we did. So if, say, a kid missed the club or couldn't make it to a meeting, it keeps everybody updated. And last but not least, they're currently working, every year they take part in a film festival. So they make a film and they come together with all the other Youth to Youth groups, and they all show their film. So this year the film is about, it's called Funny Not Funny, and it's educating students about drug references made in everyday life or everyday situations where people are joking about it, but it's really not funny. Some future goals that we have for next year, we want to do Sticker Shock, which is going into local grocery stores and putting informative stickers on alcoholic beverages, so parents are aware of how much alcohol they're having in their house. They also came up with an idea to have a movie night, and you know how when you go to the movies they always have trivia beforehand? They have some informational trivia for the guests to play. So that's one of our goals for next year. The kids also want to get more members for the group. They want to put on after-school activities Friday after school, because they're like, we need to provide a positive environment for kids to do after school on Friday, because it's very easy to just go home and do nothing or get into trouble, as they said. So that's one of our goals for next year. And we also want to pair up with other Youth to Youth groups and possibly put on a 5K for next year to promote awareness in the community. So that's pretty much where we're at and our future goals. Did any of you guys have any questions or anything? Good to go? All right, thank you. Oh, sure.
I was just wondering how much progress has been made, how much progress has been made by engaging youth in Newmarket? As I know you're using the youth-to-youth model
Yep.
out of Dover,
Yes.
but I know you want to spread this to other communities to have their youth become involved. So where are we in terms of numbers? Is it too early to tell, or?
I probably can't give you a final number just from talking to the other youth-to-youth clubs. I know in terms of Newmarket's numbers, our numbers doubled this year after our presentation. So it went from a group to about 5 or 8 kids to 15 kids regularly showing up, but 30 kids involved in the whole program. I know it's huge in Dover, and I want to say Exeter's numbers have expanded. But I can't speak for all the other ones. I'm not sure. I'd have to double check. But I'd be happy to get that information to you. Yeah, good to go? All right, thank you.
Thank you very much. And thank you, that was great. Nice to know that our kids are on the move with the rest of us, alerting, growing, trying to seek ways for prevention. Prevention is the key, right? The other side of that, though, is recovery. And as we began this work back in October, one of the things we identified early on is that our recovery options in the country are low, but certainly the recovery options here in New Hampshire are really, really challenging. We have a hard time. We have some of the lowest opportunities to receive care across the country, and it's not been an easy battle for us. However, some good news on the horizon. Many people have been doing great work, and one of the newest opportunities we have in our area that is coming online mid-May is called Safe Harbors. And we have Miss Christina Goodwin here with us tonight to tell us a little bit about Safe Harbor and community recovery coaching opportunities. So I welcome Christina as she's signing into her Google Doc. One of the exciting pieces of Safe Harbor that we're going to hear about is their connection through Christina with the local and area police departments. And Newmarket is already on board with that, having met with Christina and the team a few weeks ago. So we'll hear about that good news as well. But it's helping us to identify what to do when we have a friend, a loved one, a community member who's battling addiction of any sort. Where do you go? Who do you call? And it's wonderful to hear some of those solutions we'll hear tonight.
Okay, so Safe Harbor is a non-clinical, peer-led community resource which is open to all those who are compassionate towards and impacted by substance use disorder. So what that means is at Safe Harbor you might have somebody that is actually in recovery, or you might have a recovery ally or a family member in recovery. I'm actually, I'm a family member in recovery, which means that I have been impacted by substance use. And I'm also, and I kind of am a recovery ally because I help other people towards the different treatment processes. And so it exists to foster long-term recovery, empower individuals, as well as to support families. And we define recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. So basically, Safe Harbor is something that our communities need a lot of. We have, there's a really good recovery center that I was able to visit in Portland. It's all run, it's peer-based, which means it's run by people in recovery. The groups are run by people that are actually in recovery. There is family member resources that are within this recovery, within the recovery centers. So it's really, it's like a place where everybody can go to connect with recovery resources, whether you're a family member or you're an actual person in recovery. Peer recovery centers, what they are is they're person-centered. They expand the community's ability to be responsive to its members who are in or seeking recovery. Persons with lived experience willing to share with others, and that will include telephone recovery support, recovery and whole person coaching, recovery meetings, physical activities, mental wellness. It's kind of going through a whole wellness program with people and helping them obtain recovery through becoming well, kind of the mind, body, spirit sort of approach. And so some of the things that you see with peer-based recovery centers, there was a lot of controversy out there when people are talking about opening recovery centers in communities, because they think that it actually brings criminals to the recovery center, but it's actually the exact opposite. So some of the things that we found is that there's an improvement in steady employment, because community, at these recovery centers, they do offer resources to help somebody build a resume or job search. There's the the activity decreases in the communities because there's a place where people that are in recovery can go and be supportive and be supported. Family activities. There's actually a support group in Portland that's called Dads in Recovery, and it's just about, and so I find it absolutely positively amazing to see how incredible people are that are in recovery, or family members that are in recovery that can lead some of these support programs. So some of the things that will be offered there is peer mentoring or coaching. I'm a recovery coach myself. I went through a program that Dover, that SOS had put on in Dover, and there's a lot of really interesting things that you can learn through recovery. I'll go over recovery coaching in a minute and what that means. Peer resource connecting, so connecting with other peers, as far as, maybe whether it's resources that are available within our community, whether it's an IOP or the different treatment resources that there might be. And then different types of groups, whether it's 12-step or if it's faith-based. There's all kinds of different programs out there. Some of the other things, building community, helping peers make new friends and build healthy social networks. It's about strengthening some of that. When somebody is entering a life in recovery, it's about strengthening some of that peer support that's around them and giving them a good foundation for people around them that are making some of the same decisions towards recovery. Family support, which is huge. Families need support just as much as anybody that's in recovery does. And then vocational services, skill building, training, resume building, interviewing skills. Those are some of the things that will happen at the recovery center. There will be telephone and text recovery support, so if somebody is feeling like they might be at danger for a reoccurrence of a symptom, they'll be able to call one of these recovery support lines or text one of these support lines, and they'll get connected with a recovery coach. And then some youth recovery services, which that one's still kind of being built. I actually have been on a conference call with YPR, which is Young People in Recovery. They're global, they're national, I should say, group, and they're pretty amazing. Some of them focus on prevention inside of schools and helping to strengthen some of those programs. Some of them really focus on going up to legislation. They're all different, but they bring, and some people go in, they talk at the schools. So YPR, Young People in Recovery, will bring some different things to our community. So recovery coaches. Recovery coaches are individuals, and like I said, you don't have to be a person in recovery to become a recovery coach. You can be an ally, you can be a family member, any of that works. One of the really important things to remember as a recovery coach is it's not a clinical role, meaning that you're not a therapist, you're not a clergy member, you're not any of those things. You are a mentor to a person to help them find the best suited path for them with treatment and then into a recovery. So that it's a fine line, and there is an ethics class that we kind of go over to touch on some of that, as well as there's a 30-hour recovery coach initial training. The community access to recovery, what the community access to recovery is, it's equivalent in many ways to the Gloucester's Angels program as well as Operation Hope in Scarborough. What ours would look like here is a four-pronged approach. It's enforcement, prevention, treatment, and recovery, because I think it's really important that we keep recovery in there to make that the fourth prong. We recognize that substance use disorder is a disease. It is not something that somebody chooses to do. And there is an extreme lack of resources or a connection to resources within our communities. So it's about bringing that to a centralized location and helping people kind of navigate that field instead of turning to Google to try to figure out where the closest treatment facility is. One of the philosophy of the participating police departments will be officers responding to any call for service or performing any police action will be aware of the potential that the involved parties may be suffering from heroin and or opiate use. Officers interacting with people with substance use disorder will be professional, compassionate, and understanding at all times. In all instances, officers will continue to take enforcement action within their discretion and normal scope of duties to address criminal activity. At the same time, they will also continue to recognize that the fact that such criminal activity may result from a medical condition like substance use disorder. Some of the opportunities as far as being able to become involved in community access to recovery are the Recovery Coach program, which is 30 hours, and we do a 2-hour orientation for all of our volunteers that go over what our expectations are, some of those ethics guidelines. There's angels, and our angels are people that do a lot of the behind-the-scenes work. So they'll be talking to the treatment centers, they'll be talking to the outpatient clinics, they'll be talking to whether it's Smart Recovery or AA or NA and getting some of those meeting locations and times and making sure we're always up to date on where things are, where meetings are happening. Celebrate Recovery, there's a ton of them. And the angels are also people that will not have one-on-one contact with the participant that comes in through community access to recovery. The recovery coaches will do that. However, if there is a situation that might arise that a recovery coach may need somebody to assist them in that, then we would call an angel in if they were trying to get into an inpatient facility and there were some barriers there. So other volunteer opportunities besides those two, fundraising, community awareness campaigns, the list goes on. Really, people ask all the time, how can we help? And I said, sometimes it's just as simple as taking an hour out of a month and hanging up flyers for a local, for a local meeting. Or, so that's one of the things that that I think is pretty amazing, because you don't have to volunteer 40 hours a week to make a real difference. You can put in an hour a month. So how the process will work, somebody will walk into one of the local participating police departments. Right now we've been in conversations with Newmarket PD. There's Elliott, Kittery, York in Maine. There is Dover, Portsmouth, and Rochester for New Hampshire. So what will happen when we launch, our launch date is for mid-May, so middle of this month, and what will happen is somebody can walk into the police department. The police department has, and each police department might do things a little differently depending on what their criteria is that they meet. We'll walk through that criteria. After they've done that, the police officer that had the initial contact with a participant will transport to the closest participating medical facility, which right now we have confirmation from Wentworth Douglas Hospital and Portsmouth Hospital that they're 100% on board. I know that Frisbee Memorial Hospital is as well, but there's still some fine tuning there. So when we launch, the two hospitals that will definitely be on board is Portsmouth and Wentworth Douglas. The police officer will take the person to the hospital. We're doing that because that's more of a neutral location. If there was a crisis that arose medically, we have medical staff on there that can attend to that crisis. Or if there's a need for an inpatient facility, they can do that medical clearance right there on site. So we won't have to be trying to backtrack to find a physician that can do that. So the recovery coach will actually meet and they'll talk to the participant at the hospital. And so that interview will take place. It could, who knows how long it would be. It could be connecting them to a meeting. It could be connecting them to an IOP. It could be connecting them to an inpatient facility. It's really going to matter where they're at on their path. If for some reason that the participant does not enter an inpatient program, then we will make sure they have access to the recovery coach line, and they will also have whatever the plan is that we laid out, they'll have that all in writing when they leave. So if it was that they wanted to be connected to AA meetings within their communities or SMART recovery meetings or whatever within their community. They'll have all that information before they leave. That's where we're at on that, and that will happen the middle of this month. There's a lot of really good conversations. We started talking about this in January. So we're totally ready to launch. One thing that Wentworth Douglas Hospital is going to be offering that is a little bit different than some of the other participating hospitals is because of Goodwin, they are going to, when the participant leaves after meeting with a recovery coach, they will be able to be provided with a Narcan kit, which as we know is part of what we are all trying to do. And then the last thing I just wanted to touch on is one of the things that my family helped to start was Out of the Shadows. I lost my brother to a heroin overdose in November. It was not due to the fact that he wasn't seeking treatment because he was. He was put into an inpatient detox facility with promise of an inpatient bed when he got done with his detox. His inpatient bed was given away, he was sent home, and he overdosed. We can't keep continuing to have that happen within our communities. If people are accessing any of our services, we need to make sure we have a plan and that we have people that are going to support them, which is where the community access to recovery really comes in. But Out of the Shadows is just a little grassroots community meeting, I'll say, that happens within the church that I'm part of, which is the First Congregational Church in Elliott. And we just meet once a month on the fourth Tuesday, and it looks different every time. One time we had a YPR presentation from somebody that runs a YPR chapter in Biddeford. And then last week, we had a presentation of the Anonymous People, which if anybody hasn't seen that movie, I really recommend it. You can see it on Netflix and I believe YouTube, and of course you can purchase it through Amazon. But that's an absolutely amazing movie and a portrayal about how as people we need to stop being anonymous, because in order for recovery to be visible, we have to be talking. It can't continue to be an anonymous process. Because we want people to go out there and know that it is possible to obtain that. So I think that is it for me.
I have a couple of questions for you, just
Sure.
to clarify a few
Yeah.
things that you shared. First of all, where is Safe Harbors located?
That will be at 865 Islington Street in Portsmouth.
And if someone wanted to access Safe Harbors without going through the police department,
Yeah.
how does that work? How does that process, part of the process work?
Sure. There'll be for people that are struggling with active substance use, there'll be the recovery coach line that they can access, and then they can be connected from there, and a meeting can take place. It doesn't have to go through the police department. The police right now are just saying right now we're going to be a pathway to treatment. This is not the long-term plan. This is a temporary plan until we have the resources in place that we really need within our
So a
community.
pathway, not a gateway. So people can go to the police and seek
Right.
help, and Newmarket is on the cusp of becoming
Yeah,
active
and there's
with
a lot of
that.
conversations that are going on in Newmarket.
Or
yeah.
there's the 24/7 recovery line that
Correct.
will be open for business mid-May?
Mid-May, yeah,
Mid-May.
that's what we're saying right now,
Okay.
yeah. Safe Harbor hopes to open by May 23rd, so.
And then the recovery coach process. One of
Yeah.
the things that we understand, so you are a recovery coach, and recovery coaches are volunteers who are trained
Correct.
30 hours plus 2 hours of orientation to become a coach to someone moving through the recovery process.
Right.
Are there required hours? Could you explain a little bit more about how the recovery coach volunteer mechanism will work and what the commitment is?
Sure. The recovery coach, you do that initial 30-hour training. It's 5 days a week. I have seen some that do every Saturday, and then I've also seen some that run Monday through Friday. Basically, there's not really any requirements, just a passion to help people obtain a life in recovery. You don't have to have any special qualifications to become a recovery coach. And then after you do that initial 30-hour training, there is different trainings that are available, whether it's an ethics class, and then there's a whole, I can't off the top of my head name all the other recovery coach classes that you do have, but you can actually become a certified recovery coach, and it looks different depending on states, what classes you need to take to kind of obtain that. So, and that we're hoping to have another group of those classes run sometime in July, maybe. That's the goal, just because we have all these things that we're trying to launch right now. So.
And I think I've heard there are 50 to 60 recovery coaches currently
Yeah,
trained
we have about
across the Seacoast.
56. Yeah, we have about 56 that were just trained in the last 2 classes that are interested in being part of the community access to recovery. So we'll always have 3 recovery coaches on call. The police department hours are going to be 9 to 4 Monday through Friday to access the community access to recovery. Well, then the phone line for the recovery coaches will also be available outside of those hours. But for right now, we're saying 9 to 4, and that's not because that's the times that we think that people struggle the most. That's the times when a lot of the insurance companies are open, and if you have to go through any sort of prior auth or any sort of thing to do with insurance companies, you want to make sure that you're going to be able to talk to a live person. So that's why we kind of set it up to mirror some of those hours. So I guess the other thing that needs to be changed is how the insurance companies handle those calls, and they're available outside of those hours, and then we'll be able to.
Thank you.
You're welcome.
Are there other questions?
We kind of divide and conquer. So there's other groups of people that are talking to other medical facilities. So at this point, I can't say yes and I can't say no. We kind of all come to the table about every 4 weeks and give updates on where we stand. And there could be 7 conversations between today and Friday that we all know about, next week, because there's a lot of people doing a lot of really great work.
And that question was, is Exeter Hospital participating? And thank you.
Yeah.
Other questions? Okay. Well, thank you very much.
Thank you.
So at this time for our gathering, if there are any other questions in general that anyone would like to ask, we have people here that are trained and ready to answer questions for you. Yes.
I think speaking to you, officer, maybe it's a rumor, but I've heard that the fields between the high school and the elementary school, there's a lot of needles out there, and I don't know if that's true or not, or I'm just wondering if there's more activity out there, and especially because it's on school grounds. So if you can answer that, please.
Sure. The actual property that abuts the school, it isn't actually, I'm sorry? It isn't actually town property. That's actually privately owned. We do realize that there are trails and activities that occur out there. I have not heard, this is the first I've heard of any needles being out there. That would be a concern, so obviously we would take a look into that. But I say to anyone, if you see activity, while you're out at any sporting events or you're here at the community center and you see activity going on the other side of that fence, by all means, if you don't have a phone, you could always ride by the PD and just have us do a walk through there. We'll gladly park and walk and check it out. It's a tough situation for the police department to be, everywhere, taking a look at everything. But if we know that that's a point of interest that we would want to look into, then absolutely. That's the first I heard of it. So maybe we'll be taking a look at that in the next couple of days. So thank you.
Thank you.
Any other questions? We will offer Narcan training following this time for anyone who would like to stay for that. And I'd also like to close with another Newmarket update. As we talk about recovery services and services available, we do have various recovery-focused meetings that are happening right here in town every week. Starting with Sunday night, we have a men's AA meeting right here at the rec center that meets at 7 p.m. On Monday night, we have a Families in Recovery meeting that meets at Lamprey Healthcare Center at 7 p.m. On Tuesday night, we have a AA meeting that meets at Newmarket Community Church that is focused on meditation and AA. And on Wednesday evening, we have an AA meeting at 7 p.m. and a Heroin Anonymous meeting at 7:30 p.m., both at Newmarket Community Church. So there's a lot going on here in town. There are people every week that are meeting. There are places to go if you need help. As you heard, our police force is poised and ready to help and working that through. So please know you are living in a caring and loving and supportive community. And we hope and pray that our work is going to lead us to a healthier place to live, where we are free from things like needles on the ground, and know that our children can run through those fields freely and comfortably and safely. We are doing good work, and we will continue. Thank you very much.